Dr. Salim bin Khamis Al-Arimi, Deputy Vice-Chancellor and Provost, National University of Science and Technology, Professor Mohammed Al-Shafi'i, Dean, College of Medicine and Health Sciences, dear guest speakers, faculty and students, Assalamu alaikum. I would like to welcome you all to one of the long-awaited events of this year, the 4th Winter Symposium. My name is Aisha Salim Al-Batashi. I'm a 7th-year student here at National University of Science and Technology, and I'll be one of the moderators for today's event, together with Dr. Najm Siddiqui. This event is under the patronage of our special guest for today, Dr. Ali bin Saud Al-Bimani. Dr. Ali, we would like to extend a warm welcome. We really appreciate you taking your time out of your busy schedule to support this event. As you all know, this event is a platform for researchers to present their work and experiences. So far, the National University has held 3 previous symposiums, and this is the 4th Winter Symposium. The main theme of this year's event is COVID-19 and the role of research in pandemics. Before proceeding, we will open the ceremony with a recitation of the Holy Quran. Sadaqallahu al-Azim. I'd like to extend an invitation to our Deputy Vice-Chancellor, Dr. Salim bin Khamis Al-Arimi, to welcome our attendees. Welcome, Dr. Salim.
Dr. Ali Al-Bimani, our Vice-Chancellor, Professor Mohammed Al-Shafi'i, Dean of the College, our respected guest speakers, our faculty and staff, dear students. It is my great pleasure and joy to welcome you all to this special event, the 4th Winter Symposium on the role of research in the pandemic COVID-19. No doubt that COVID-19 had greatly affected societies and economies in Oman and around the globe. Let me remind all of you, being in the profession of medical and health sciences, about the importance of research and innovation for meeting the ongoing challenges of this pandemic situation. At the same time, I take this opportunity to applaud the efforts of the researchers in Oman and all over the world who have been working diligently to discover solutions for this problem. As you know, COVID-19 has changed the way we do almost everything, and we continue to live under various lockdowns and restrictions, which are posing many challenges for academic research. The foremost challenges is the need to carry out research ensuring safety for the participants and researchers. However, it brings enormous opportunities for researchers to move forward with the object of inventing a new medicine and vaccines. A lot of efforts are initiated by the government to support research in this area. One of these initiatives is the COVID-19 research programs of TRC to support and guide research projects focusing on COVID-19. To this end, National University believes in the mutual reinforcement of teaching and research, which impacts positively on this learning environment and aspire to continuously transfer to the research outcomes for social benefit. The culture of research has been running among the faculty and students of NU and the College of Medicine and Health Sciences since its inception of this college. Our researchers are working with the Research Council, industries, government organizations, hospitals, clinics, and international research institutions to make an impact in research and innovation. NU encourages and supports students to undertake research and consultancy activities. Staff and students of NU have successfully implemented more than 80 funded research projects since 2009. Out of this, 50 of them are undergraduate research grants, the URG project meant for supporting student research. More than 250 students have participated in our research projects. Our students have an excellent record of research and innovation, resulting in more than 220 publications in reputed journals and conference proceedings. NU Research has won 25 awards in the last 5 years at national and international levels, which lead to high levels of recognition of our student innovation and output through quality publication. I wish to reiterate, NU is very committed to stimulating student interest in research and innovation by providing various opportunities, including internal research grant to students. This is an annual program, undergraduate research grant from Ministry of Higher Education, Research and Innovation, TRC, participating in the faculty research project with profession for student researchers to work as a research assistant, seeding fund for research and innovation and entrepreneurship development, support a student to participate in conference and symposium, student exchange and international internship programs. And he was very proud in playing its part to find a solution to this challenge facing humanity. And I am very grateful to the organizers for organizing this symposium at this juncture. I wish you all the best for the successful organization of the symposium. And I would like to thank the Dean, faculty, staff, and students of the college for their hard work and preparation for this symposium. Wassalamu alaikum wa rahmatullahi wa barakatuh.
Thank you, Dr. Salim. Now I would like to welcome the Dean of the College of Medicine and Health Sciences, Professor Majid Al-Salamani, to introduce the event.
Good evening. Dr. Ali bin Saud Al-Bimani, Vice-chancellor of the National University of Science and Technology, chief guest and patron of our 4th Winter Symposium, Role of Research in Pandemics, COVID-19. Dr. Salim bin Khamis Al-Aremi, Deputy Vice-Chancellor and Provost, National University of Science and Technology, distinguished guests, our eminent speakers, dear faculty, staff, and students. Thank you to each and every one of you for being here with us this evening. We are very pleased to welcome you all to this virtual meeting. I heartily welcome our honorable chief guest and our distinguished guest who kindly accepted our invitations in spite of their busy schedules. We are aware that virtual meetings has its limitations when compared to physical meetings. But I do believe it is important we continue to discuss the vital issues even in the middle of the crisis that has challenged us in many ways. The restrictions forced upon us by the COVID-19 pandemic will continue in the coming weeks and months, but in the meantime, the pandemic has helped to focus our minds on how best to move forward. College of Medicine and Health Sciences, National University of Science and Technology hold this symposium in the winter every year, and this is the 4th year. It is a showcase of our students' leadership, engagement, research, and creative work. Usually, there is a theme for each event. Our students recognize the importance of research, specifically in this devastating pandemic of COVID-19. It is in this context that organizers of the Winter Symposium has aptly chosen the topic, Role of Research in Pandemics, COVID-19. A global challenge like the current COVID pandemic can only be defeated when research results are rapidly and openly shared and all stakeholders work together: scientists, healthcare workers, policymakers, and government officials. This symposium provides an excellent platform for students, researchers, and healthcare workers from various universities, research institutes, and health sector from Oman and outside Oman to share their ideas, research results, and discuss recent developments. We have over 2 evenings, rich and intellectually stimulating programs of talks from eminent researchers, research presentations, and case studies. Education at our college is based on a concept that teaching and learning involve not just the transfer of specialized knowledge, but also a commitment to developing the whole person. We believe that specialized knowledge may quickly become obsolete, but horizons broadened by excellent education do not. We are committed to graduate not only treating physicians, but also leaders, lifelong learners, researchers, and creative citizens. I would like to take this opportunity and thank in advance our distinguished guest speakers on both days. Also, I would like to extend my great thanks to our students for their outstanding organization. Mr. Saif Al-Badwawi, Senior IT Manager, for his IT support. Ms. Arwa Al-Sabri and Mr. Saeed Al-Kindi for their admin support. And Umar Al-Hosni for his media support. Professor Najm Siddiqui and Dr. Suad Ukla for their overall guidance of the team. Last but not least, we would like to express our sincere gratitude and thanks to our chief guest, Dr. Ali bin Saud Al-Bimani, Vice-chancellor, National University of Science and Technology. Thank you so much and wish you enjoyable and fruitful symposium. Thank you.
Thank you, Dr. Mohammed. I would like to welcome one of our National University students and the local officer for SCORI, Yasmin Rashid Al-Balushi, to speak a few words on the event. Welcome, Yasmin.
Assalamu alaikum wa rahmatullahi wa barakatuh. Honorable Dr. Ali bin Saud Al-Bimani, Vice-chancellor, National University of Science and Technology. Dr. Salam Al-Arimi, the Deputy Vice-chancellor of National University of Science and Technology. Professor Muhammad Al-Shafi'i, the Dean of College of Medicine and Health Sciences. Respected guests, speakers, faculty, and fellow students. It is my great honor to welcome you all to the 4th Winter Symposium 2021. Like every year since 2018, we wanted to continue this legacy this year also. Despite facing extraordinary challenges, we made it. This year, in light of a current devastating pandemic, we decided to host the sessions online. And for this, I would like to thank the organizing committee for their effort and commitment, for making this event possible. And also, I would like to take this opportunity and thank all the speakers and researchers who accepted to be part of this event and put up with our countless emails and phone calls. The COVID-19 crisis has brought with itself so many challenges, and it has made us all realize how unprepared we are in the face of a novel pathogen. And it has made us realize the vital role research plays in medicine. Research has allowed us to compare and contrast between various treatment plans for dealing with COVID patients. And using the data, medical teams around the world have been able to use this and reach this approach. Over the 2 next days, I will use my glasses. Over the 2 next days, we hope to educate current and prospective medical professionals on how we can be better prepared for a future pandemic, how we can improve research in Oman and achieve Vision 2040, and what Oman needs to start producing its own vaccines. We also hope to deliver some of important studies that have been done during this pandemic and the things we can learn from them. At the end, I hope you will be able to appreciate the role of research, and I hope that Oman will produce many more researchers and studies in the future. Thank you and enjoy the program.
Thank you, Yasmin. Now, Dr. Najm Siddiqui will continue with the plenary sessions.
Thank you very much, Aisha. I would like to take this opportunity now to introduce the guest speaker. Our first guest speaker is Dr. Majid Al-Salamani. He's an assistant professor in physiology at the Natural and Medical Sciences Research Center, University of Nizwa. He's a PhD in physiology from the University of Bristol and bachelor's from the University of Glasgow. Prior to his PhD, Dr. Majid worked as a research fellow with Dr. Uwe Fass at our Oman Medical College on cystic fibrosis genetics. His PhD is on cystic fibrosis mutation in Omani population. Currently, Dr. Majid teaches human physiology at Nizwa University. His title of the talk is The Future of Research in Oman. Dr. Majid, you are welcome to start your speech. You have 20 minutes for this presentation. Dr. Majid.
Assalamu alaikum wa rahmatullahi wa barakatuh. I hope everyone is fine. Is my voice clear to everyone right now? Yes, your voice is clear, Dr. Majid. Okay, great. I shall start then. سيد المرسلين سيدنا محمد وعلى آله وصحبه أجمعين. Today, I mean, in the sake of time, I just start immediately. I would first like to thank the organizers for inviting me to speak at this conference, at this event, I would say symposium. This is the second time that I speak at Winter Symposium at National University. And today, I was asked to actually talk about the future of research in Oman. Because I find this topic a very challenging and difficult topic to actually talk about. Because of the nature of future, we cannot predict the future. I'm based on the present situation, unless we have certain readings or foresight to actually build our opinion of the future. For this reason, I decided to look at the future from a philosophical way and based on the plans that were put by governmental agencies, I would say. So, thinking about the future, we have a number of research institutions. I'm starting with academic institutions. We have around 10 universities in Oman and other research institutions that are attached to ministries or work under industry, like for industry services. And all of these institutions is the basis for the future of research in Oman. And like for health research, universities and institutions of the Ministry of Health, and the growing pharmaceutical industry or industries that is health is what actually the topic of research in medicine, and the topic that we are discussing today, including the issue of the pandemic. Now, like talking about the future, I find it difficult to actually talk it, as I already said. But the best foresight of the future, I find to be through the Oman 2040 vision, which was, should have started like in effect this year, and is seeing Oman as a country of certain values in 2040. And so let me quote the words of His Majesty Sultan Haytham bin Tarik about the vision in his first address, when he said, "The vision builds on the principles of citizenship and genuine identity to modernize the educational ecosystem, support scientific research and innovation, and develop healthcare regulations and services, and lay the foundations for social well-being and relevant basic services for all segments of society." And we can see clearly the philosophical values that His Majesty has put in his words, and in the also overall plan of his 2040 vision, which include modernize the education ecosystem and support scientific research and innovation. And in fact, scientific research and innovation has been mentioned a lot in the Oman Vision 2040 plan, which includes many priorities, priorities that can be summarized in keywords, I would say. And these include priorities that stem from philosophical values that the society and the country should hold. I'm sorry that my voice is not very clear. I will try to change. So is my voice better right now? Okay, I shall continue then. Okay, these values and so priorities, I would say, some of them stem from core philosophical values for the society, which include, so in my opinion, include scientific research, education, and citizenship, which are really, we need it as a society to build a scientific and successful country in the future. And other priorities, so relate to the well-being, well-being, I would say, of a society and of the economy as well, which are equally important. Okay, starting with scientific research and education, I find them core values in the, so as priorities in the Oman 2040 vision. Okay, and when I start to think about what does scientific research and education originate from, so I thought a lot about it, and so the basic thing is that scientific research, so what I found from well, a little knowledge about it, I would say, is actually originates in the brain of a human being. And it has been actually discussed a lot by philosophers in ancient times, even in the time of ancient Greece, okay, where people have discussed knowledge, creativity, consciousness, and will, I would say. So the scientific research is actually the area where creativity and knowledge play their role, okay? And this is where innovation and advancement in certain scientific engineering areas come about. However, like creativity and knowledge, while they actually stem from the brain of the human being, they will not exist in a human without the presence of self-consciousness and the will to actually do research, where self-consciousness actually makes the person able to understand and see himself where he is, where he currently is, and the will makes him actually proceed forward. So actually, this is in a human being, but if we start to actually, or we want to actually generalize this to an, let's say, an institution, okay, can we generalize all of these concepts that stem from the brain of a human being to a scientific institution, I would say? A scientific institution, so best actually, so a successful scientific institution should be conscious of itself and of its abilities, okay, to do research and okay, of its importance in society and of its importance in history as well. In addition to also the presence of will by people who actually run the institution, let's say it's an industry or something, okay? In addition to the presence of knowledge and also creativity, where all of these are the core values for a successful scientific institution. And then the other plans and priorities, like material priorities, okay, come later, starting from these core values. And this goes as well to a scientific country. And if we think about a scientific Oman, okay, scientific Oman as a society, okay, and as a government, as well as institutions, all of this, then, okay, should be conscious of their power, okay, in the middle of all powers in the world. And there should be a will by the government, by agencies that create policies, other stuff, funding agencies, to actually support scientific research. In addition to that, knowledge and creativity are well, essential, as we have discussed already. So yeah, I wanted to actually go from these values and start to discuss two values for research, which is basically the will to do research and creativity. I'll start with creativity, and creativity in the eyes of philosophers. If I go back like 3 centuries to the beginning of the Renaissance in Europe, we find philosophers where they actually they see creativity as basically as the beauty in art and poetry. And 2 of them are Immanuel Kant and Arthur Schopenhauer, where Immanuel Kant actually sees creativity as, so conceives it of artistic genius as an innate capacity to produce work of exemplary originality through the free play of the imagination, a process which does not consist in following rules and can neither be learned nor taught, and is mysterious even to geniuses themselves. Arthur Schopenhauer, on the other hand, stressed that the greatest artists are distinguished not only by the technical skills they employ in the production of art, but also by the capacity to lose themselves in the experience of what is beautiful and sublime. Yes, they are actually talking about art, poetry, and whatever, but actually creativity extends beyond art and poetry and goes to modern sciences, modern technology, modern research areas, even in health, in biology, in other topics, okay? And the keywords here, which I could actually see, the originality, okay, is required, and we are not, many research in the country, in our country, okay, doesn't lack originality, and well, originality can be found anytime. Imagination, okay, technical skills, we are not short of technical skills and imagination. But what Schopenhauer describes as lose themselves is something of deep meaning, okay, which is actually, so we need, maybe I would say, we need people to lose themselves in the beauty of scientific findings and innovation. So we need to encourage, let's say, so starting from an individual, we need to encourage people to involve in scientific research and see the beauty in it and lose themselves in this beauty and innovate. The same with institutions and the same with a whole country. And this where basically scientific research, I would think, so in the West, actually, how it evolves, because people love what they do. And so from my experience with young individuals, I find, like, from my interaction with people, I find that there are many intelligent individuals, okay, but because of the general idea about how hard it is to actually do research, how much time the research needs to be spent, so needs to be spent time on it, I would say. And how much money one can get from just doing research is not a lot. We lose a lot of genius in the process of producing a functional human being, a functional citizen. When we teach the students, and this has to be changed. The same with institutions, same with industry, and something in the industry sector, where people stick to certain things and they are afraid of making new progresses. So how can we persuade them to actually do research? So I thought a lot about it, and I believe there's a lot of things written about it. But just from my experience, that we need to actually persuade young individuals to do research, and so institutions to do involve themselves and understand and be conscious that research is important for their development and the development of the country and their employees or whoever is in the institution. Okay, and so I thought, well, I heard about this, values in social sciences, where they actually use, a concept called, so they have studied a concept called social proof. Okay, and there's an example of a social experiment. Basically, this experiment was done at hotels, where basically hotels want to persuade to actually let whoever enters the hotel recycle their towels in order to actually save costs and eventually save the environment. And they have put two examples here where they have done social experiments. So where group of people, they have given a note saying that help us, so on their help us save the environment by reusing your towels. So only 38% of the customers responded to this request. However, when they changed the language, okay, and used the power of social, so the power of peers, of groups, of other people, of common belief, okay, and they said most of our guests reuse their towels and save the environment. 53% of the guests actually reuse their towels. So this type of language and type of use of the power of social proof of احنا نسميه بالعربي العقل الجمعي، تمام؟ a mind of common people, okay, that they follow the crowd. So it's a simple idea. We could use just to persuade young and intelligent people to do science, and to persuade maybe faculty members to do research, and to persuade institutions to do research. I would like you to actually think more about how to do this from a using the science of persuasion. And so this is an issue I wanted to actually present. So I believe the future is through, comes through the individual and comes through a deep philosophy, starting from the individual to institutions and then to society and whole country. Thank you very much.
Lose themselves in the beauty of scientific findings and innovation. Think more about research for scientific Oman. This was Dr. Majid. Thank you very much, Dr. Majid, for your innovative presentation. And now I would like to invite our next guest speaker, Dr. Khalid Al-Rasabi. He is Associate Professor at the Department of Biochemistry at College of Medicine and Health Sciences, Sultan Qaboos University. He is also the Director of Medical Research Center at the same university. He is one of the founder members and president of Oman Society of Lipid and Atherosclerosis. Dr. Khalid obtained his medical degree in 1998, postgraduate training in medical biochemistry at McGill University, Canada, and worked at the Royal Victoria Hospital, McGill University. He performed several studies on the molecular genetics of familial hypercholesterolemia and published more than 100 papers. So please welcome Dr. Khalid. His topic is how to prevent, handle future global pandemic, a very important topic. Dr. Khalid, you have 20 minutes for your presentation.
Sure.
Dr. Khalid.
Thank you very much for the generous introduction. And I would like also to extend my, my sincere thanks to the organizer for inviting me. I just have one disclosure that I have presented these slides also to the Oman Medical Specialty Board, but this is for the postgrad. And I believe we are talking about research here. So it is as significant, important also for our undergrad students, because they will be the future healthcare provider, future researcher. So I think we need to prepare them very well. I would like really to share with you one of very, very important publication, which is an open access, and the full report, you can access it. And this really talks about what we call research future. We know that advances in technology, funding pressures, political uncertainty, population shift, societal challenges on a global scale, all these elements had transformed how research is produced, how research is disseminated. To assess how today trends might shape the research landscape in the 10 years coming ahead, Elsevier joined forces with another global market and opinion research specialist, the Ipsos Mori. They conducted a large-scale future scope and also scenario planning study. They did an interview with more than 50 leader in universities, researchers, publishers, and more than 2,000 researchers as well. They focus on was not on which topics they will be researched in the coming 10 years, but rather on how research might be conducted and its finding is communicated. So again, this is an open access. You can go and read the full report. It's very, very important really to shape our future research. Unfortunately, most of those researchers was from, I will not say unfortunately, but unfortunately for our region, because North America, Europe, and Asia Pacific was included. Unfortunately, Middle East was not. So I hope maybe this report will come back to look at our gaps and unmet needed in the region, and will help us to make some decision. So these are some what we call some challenges, opportunities, and some recommendation from the information provider. So I will start with open science. Open science, we mean that the availability of the research data. So one of the way is an open access journals. So we know that publishers have now moved from what we call subscription-based journal to an open access. Although this is a very slow and it does not pick up, but we know that definitely it will grow over the next 10 years. A lot of publishers now joining effort to combine what we call mega publisher. So joining a lot of data that can be shared with researchers and scientists. The other thing is what we call reproducibility of the data. Although this is very important really to validate research methods and research results, but some researchers look at it as maybe it will hold their career or innovations. But really this is very important, and this is what we do, and this is what increase our number of publications. But to do that, we definitely need what we call to flag validated study to ensure more open availability of data and standardized description of method, and also to allow these reproducible data to be published other than the articles. We need to create or launch what we call bespoke journals, repositories for replication this study. The other thing that they had looked is the working culture. So provider should continue to develop what we call research tools. Very, very important. And this is what we see the publisher or the new setup companies do this platform to encourage researcher to share their data, to communicate with their peers, to help them also write their articles and find funds as well, and maybe store the experimental data. So this is very, very important for future to help define that. The other thing is also, and we have spoken about that, we need, especially when it comes to what we call negative results, we find a way of publishing because it is as important as positive results as well. So again, pre-registration of these studies, bespoke journals and repositories. The other thing that also with the working culture, and we had seen that in COVID-19 pandemics, that the interdisciplinary and also cross boundaries of sharing data. We see scientists sharing genomic data, sharing results from clinical trials, vaccines, therapeutic medication, and so on. So this is the beauty about doing research. It's not me, myself, that I will take credit, but I should share this data with the others. Funding is very important, and we know that since 2018 financial crisis, that funding is going less and less, and this put challenges, especially to the academic institution to support their researcher. So academia and has found a way of collaborating with what we call philanthropic sources like charities, like industries, to support their funding. Although they go more with these charities because they don't restrict their type of design or dissemination of study, but still even with the industry, especially with a contract sign, that can be done as well, especially if we see that what we produce really impact the society. Technology and using artificial intelligence, very, very important. And now it is utilized even with the publisher to review the process. I mean, to check plagiarism and also peer review for any novelty or quality of this research to speed up the publications as well. Also, this technology definitely can be used for remote education and others. Education and engagement. Also, we need to help researchers demonstrate societal impact, improve tracking of real-world impact as a commercial application, policy development, and clinical practice and health outcome. So this is really very important. And we know that the pandemic has only highlighted the urgency of this research to communicate and join force to address these challenges. How COVID-19 pandemic affected pattern of work of life of scientists. This is one of a survey that included more than 100 individuals, and you can see a various response. Lockdown has, created problems, especially those who do wet labs, and but nonetheless, it really shifted the people to sit down, write their manuscript, thinking about way of new funding, way of supporting other scientists, especially with the COVID-19. So it's not all as we can look at it as disadvantage, but also as an advantage of for the other scientists. I will not go through the details of this table, but this is one of the beauty when we have pandemic. Then we know that most of resources are shifted to treat or to do more researches for the development of therapeutics or vaccine against the COVID-19. So we saw that with the clinical trial. Most of the resources was really directed to find an antiviral treatment and vaccine, and that was really prioritized. Also, when we look at the ethical approval for COVID-19 study, it was faster, and the review approval was communicated directly. Financial management again accelerated with the COVID-19. Study timelines, first participant enrolled was very short. I mean, giving the short term of tackling these pandemics and so on. But I mean, for the non-COVID-19, we saw how technology helped dealing with these some issues with the clinical trials, like recruiting patients, following patients. So technology had played a major important role in with telemedicine, with e-consent taking and so on. So really, this is why technology will be the future and the shape of research. So this is from the World Health Organization, and this is how the ethical standard for research during pandemics should be done. So they have to be met, like scientific validity, social value, collaborative partnership, reasonable risk-benefit ratio, fair and voluntary participation, and independent review. Again, this is one of the excellent study done in Germany over more than 50 research center, and they looked at the research ethics committee, what were their challenges and what was the proposed solution to fasten the process and resolve some of the issue with the COVID-19 ethical. Again, I will not go into details, but I will show you some of the example. So for example, if we look at the social value, some of the challenges was lack of coordination and structure in the study planning. Like there was a lot of simultaneous studies on COVID-19, even in the same institution. And this is what, again, we had faced even in Oman here, even in the university. So many studies, some of them, they resemble each other. And again, this will make definitely loads on the research ethics committee. Again, large number of small study overlap with other studies and lack of concrete objectives. So some solution for that this study can come together, be coordinated at the same institution level, really to optimize resources. Another issue is the scientific validity. Again, when we look at the insufficient information to the research ethics committee, lack of biometrics, lack of disclosure of funding, and description of data, and so on. So some of the better information usually request again to from the expert to submit suggested biometrics. Studies can be divided into major and minor sub studies, and Programmatic assessment of initial proposal could be tailored if the interim evaluation were planned. Ethical principles, and this is again one of the challenges, even if I'm sure even here, in the informed consent. We see patients who are admitted at the intensive care unit, and how you are going to consent these patients, for recruiting into either therapeutic, experimental therapeutics, or others type of treatment. So again, there was problem with whether verbal consent is accepted, electronic consent is accepted, and so on. So alternative to this, patient who can not give the consent, they have they can be delayed till they gain the ability to do that, or it can be taken by their caregiver, or again remotely. It can be done with again verbal consent, and so on. Risk ratio benefit, again, especially in the case of interventional trials, difficulty regarding uncertainty about the disease, because there is little preliminary data. So it will be really difficult for the ethical committee to decide about that. So again, also for amount and frequent of blood samples, another thing. So one of the solutions for blood test, consent can use for residual blood from routine examination after the patient again regained the ability to give the consent for that. So some of the rapidly growing number of studies during the COVID-19, what we had learned from that. So we saw that the number of coronavirus articles reached almost more than 23,000 on the Web of Science, on Scopus, and this is again in very short period. So really how to deal with this big information, how to validate that, this is again is very challenging. This is why again the beauty of using technology like artificial intelligence and so on to validate some of the study is very important. Survey revealed gaps in coronavirus research, although most of these clinical trials underway to find vaccines and treatment, but we forgot that research on public trust, mental health intervention, some social issue, these are domestic violence, these are were somehow neglected, but I am sure this will be definitely of important also to study, as important of finding treatment for these patients. Journal and researchers are rapidly adapting their publishing practice in response to the COVID-19 pandemic. We see fast track review, open access, open science. We have spoken about that. Using of the artificial intelligence for data research analysis, preprint, priority data calls with authors, and for the role of reprints, especially when we talk about the bio archive or the mid archives, which is a preprint, how scientists again share their data to help other scientists also to come up with solutions. People were tweeting more than 10,000 times of tweets. We saw some of those was really very important. So all this, we see it very common in the pandemic, but also in the non-pandemic preprints. So research center as important to support the program for the COVID-19 research program for both clinical and non-clinical had supported with approximately more than 280,000. I know that it's now under the umbrella of higher education, but this is really very important. This is one of the plan when my colleague was talking about the future of research in Oman to support the Oman Vision 2040 is really to find a way of urgent and funding for doing research, developing treatment, developing vaccine, building infrastructure and technology also to support all the young scientists for that. So I will finish here with the a quote from one of the physician, Harlan, who is School of Medicine, Yale. He said, "I hope it will be because we need to be able to now grab onto this innovation that occurred during the pandemic and recognize that they were all in a theme of speed, a theme of efficiency, a theme of reducing burden, a theme of better engaging people and reaching them where they live, taking advantage of data that was being created for other purposes, and whenever possible, utilizing that within either experimental or observational design." With that, again, I would like to thank the organizer and looking forward for any questions. Thank you very much.
Thank you very much, Dr. Khalid Al-Rassadi. He was talking about how to prevent and handle future global pandemics. So now we open the forum for questions. Audience and anybody who wanted to have a question, please write in the chat box and the speakers will answer your questions. Yes, anybody from the audience, if you have any question, kindly write your question in the chat box. We have two papers done, one about the future of research in Oman by Dr. Majid, and the other by Dr. Khalid Al-Rassadi about how to prevent the future global pandemics. Dr. Khalid, it seems that we are not having any questions. So we will going to have 5 minutes.
There is a question there from
oh, there's a question.
Yeah.
Okay.
Dr. Najam, there is one question on the chat.
Yeah, I cannot.
What?
I can.
Do you want me to read the question?
Yes, please. I cannot see the.
Sorry. Yeah, it's a what would be the effect on our country in a future global pandemic happen? I think this is a very excellent question, and this is why we see that the importance of surveillance. If we have an excellent, and this is again, even globally speaking, a way of predicting how the pandemic will spread, and the way of tackling that again through using science, using medical technology is very important. So I think in our country we have an excellent talents, but also in parallel we need to invest also on the infrastructure, again on building an excellent database really to gather all the information that we had learned from COVID-19 and even the previous pandemics, and also how to utilize the technology again to detect coming pandemics and the best way to manage it. So this is in really very short scope.
Yes, Dr. Khalid, there is another question. How do you do immediate changes to the healthcare system in the country post-COVID-19?
This is a good question, and it's also very challenging. It's again, I think how the country in general, and also how the Ministry of Health and other health providers manage the COVID-19 was in an excellent way. And but we know that there will always be a challenge, and we have really to look at, and also we need always to learn from these challenges. So again, I think an excellent database, an excellent surveillance is needed, and also the using of again medical technology really to predict such pandemics and infrastructures for for future development of therapeutic medication and vaccine using our talented researcher and scientists in the country. I think it need to be collaboration between the health providers like the Ministry of Health, higher and also the other players like higher education, Ministry of Higher Educations, as well as academia. So the role of academia, especially the institution center, is also very important. So I think they should come together to facilitate this future movement of research and implement that into a good way of fighting pandemic diseases, and also not pandemic diseases. Even we are talking about non-communicable diseases, which is even more common than the pandemic, and it kills more people. We talk about cardiovascular disease, we talk about cancer. So finding really technology and therapeutics and vaccines for that is also very important.
Yes, thank you very much, Dr. Khalid. I have a brief question. I just want to ask you that how would you prevent this pandemic, COVID-19, and what is your prediction?
Yeah, it's really very difficult to, and you had seen that it was really a challenge across the globe. So again, there is no a magic answer for that, but I think again, what we need is really what we call from the research point of view. I'm talking that collaborations between again health provider and Ministry of Higher Education as well as academia to come up with future solution. I mean, now we have the vaccines, and we hope that these pandemics will go over, but we definitely need to sit down and to look at the future, how we can really tackle such pandemics in the future using again the science.
Okay, thank you so much, Dr. Khalid. Now there is a question for Dr. Majid. As a student, what privilege we get to start with our research journey and to get mentors by doctors? Dr. Majid.
Thank you very much, Dr. Najm. Nice question by Mariam. In fact, I mean, so I never think about privilege like after doing research. but actually the privilege is doing research on itself. Okay, I mean, developed country, so the development, so how much developed is a society is actually measured by how much research is being done. And so I'm doing research without even thinking, okay, about benefit, like money benefit or I mean promotion is what drives actually true research. Okay, I mean, lately research is being driven by basically the need to generate numbers, okay, get promotions and whatever. But actually, the actual privilege for the society and for yourself is doing research, because that will improve you as a student and the way you actually think about stuff. And and that cannot be compared to I mean a promotion to a certain position or something in future. Though actually I mean that what can happen, okay, what would eventually happen if you are successful in your research, and if you are active in your research, you will I mean you will get promoted, okay, a lot. And before I mean people who don't do research, and you will have a good position in the community and in the scientific, well, medical community as well. When you speak to somebody, you are talking from an experience, you are talking about stuff that you have done, okay, and that's the privilege. Okay, Dr. Najim, I'm done.
Yeah, thank you so much, Dr. Khalid. There is another question by our students, that what would be the effect on our country in the future global pandemic happened, and how do the immediate changes to the healthcare system in the current post-COVID-19?
I think we had answered partially this
Partially, yes.
this question, and we said that it was well managed by the different player, the health sector, Ministry of Health and other health providers, as well as but we need in future really to think about also the role of academia, research and scientists also to tackle such pandemics.
Okay, Dr. Khalid, thank you so much. And now we would like to have a break of 5 minutes, and then we will going to start the next session, which is going to be the presentation from our research, international research coming from New York and from other countries. So we will just have a break for 5 minutes. Dr. Aisha, you can start with the Rida because Dr. Vera, she has some problem in opening the presentation.
Okay.
No, Dr. Najam, I need to make her a presenter. Once I make her a presenter, she will be able to open.
Okay.
Aisha, 5 minutes is over.
Welcome back, everyone. We will now proceed with the research presentations. Each presentation will be for 15 minutes. We're very fortunate today that Dr. Waira Salazar Moreno is with us today. She is an internal medicine and infectious diseases specialist working at Brooke Memorial Hospital at Dunkirk, New York, USA. She's also the team leader of the Infection Prevention Committee. She has done a fellowship at the University of Massachusetts and also practices at Great Lakes Physician Practice at Dunkirk. Her topic is Research as the Way Out of the COVID Pandemic. The floor is yours, Dr. Waira.
Thank you for the invitation. Salam alaikum, colleagues. I'll try to make it quick. I have no conflicts of interest. My goal for this talk is to look at the approach of this pandemic and previous, use the evidence we have to be better prepared for the next one. As my predecessors were mentioning, this is not the first pandemic. It will not be the last, and we need to learn from each experience to do better next time. The current pandemic is caused by coronavirus, which is a family of viruses that has been around for several years and are usually the cause of the common cold. There are two kinds that can cause severe infections, MERS and SARS, and the current one is COVID-19. We learn daily from the first reports in the Wuhan market to it spreading throughout the world. We have recently marked yesterday the first year anniversary of the first case described in New York. Now, normally when we treat patients in medicine, we try to use evidence-based approach. Clearly, when we have such a new disease, we don't have the evidence that we would like to guide our decisions. We use the lowest levels of evidence and we use what we have learned from the past. But as we move on, we start building one research paper at the time, the evidence we need to improve the outcomes. Now, as scary as it might be, the more we understand, the less scared we need to be. So what have we learned so far? Well, for starters, that most of the patients do very well without treatment. So all the magical cures for the first sneeze or the first cough are don't usually make much of a difference. And we need really big sample sizes to be able to assess the impact of treatments very early on, because it's hard to know if they would have done better on their own. Now, we have been able to identify many protective factors, one of which is trained immunity. Trained immunity refers to the protection that you get against one disease that comes from a vaccine that you got for another disease. The main protective vaccine, if anything, is the BCG. Another one that has been identified is the MMR. And we were able to see that in different papers. Another protective factor is high altitude. Apparently, anywhere over 2,500 meters over sea level has a protective impact on those citizens. And this was evidenced in countries like Bolivia and China. Another protective factor is the ABO type. We know now that type group A does have a higher risk than O, and that Rh negative has a lower risk than Rh positive. So what are the risk factors for poor outcomes? Well, we have learned that many different risk factor comorbidities can cause poor outcomes, namely cardiovascular disease, diabetes, chronic lung disease. We know that age is an important factor. Kids seldom get sick, in general do much better than older adults. We do know now that low vitamin D is an independent risk factor for poor outcomes. So supplementing our patients with vitamin D has had an impact. We do need to build on what we already know when we don't have any evidence to guide us. So we do know that washing your hands help protect our patients. So we do that more diligently. It helps protect them. It helps protect us. We do know that masks help. And that has been corroborated by several meta-analyses several randomized controlled studies that have been pulled in meta-analyses that have shown that masks certainly do decrease the transfer of this disease. And we have seen that countries that did use masks from the get-go did a lot better than countries that did not use masks from the get-go. We do know that distance helps. 2 meters is the cutoff, but really the further away you are from other people, the more protected you are, which is why shutting down the major cities in the world has helped. Although, as you all know, it's very difficult to keep everybody locked down. We do know that prone position does help. So with this, we start managing patients that are really, we don't know how, because we don't have any studies. But as we move on, we have learned a lot. We have now several randomized controlled studies that have been pulled in this this meta-analysis that show that hydroxychloroquine and chloroquine do not work. So don't use it. We do know that convalescent plasma that was being used a lot all over the world in the beginning, unfortunately, does not work. We have learned that azithromycin that does have some anti-inflammatory properties, we were trying to see if that worked. Well, that does not help. Actually, the hydroxychloroquine with azithromycin increased the risk of complications and death, so don't use it. We were seeing if, well, maybe vitamin C and zinc and other supplements help, and we do have now a randomized controlled trial that says it doesn't make any difference, vitamin C and zinc specifically. So what does work? What have we learned in a year that can help our patients? Well, we know that steroids work. The recovery trial is one of the biggest trials, have been tested different treatment approaches. Dexamethasone works, it decreases death by 30%, so use it. You can also use prednisone or other steroids. You don't need a high dose, it does work. In the US, we're using remdesivir a lot. It doesn't really decrease mortality, but it has shown to decrease hospitalization time. Now, the newest one is tocilizumab. It does seem to decrease mortality in 4%. The NIH still hasn't changed its position. This is based on preprint information, but it is the recovery collaborative, and it's just a matter of time before they do. Some hospitals are already using it. Ivermectin has been widely used in South America, and I understand some Middle Eastern countries as well. There is growing evidence that it might have a role in early disease more than late disease. In the US, the NIH recently changed their position from recommending against the use to not recommending in favor or against, based on the growing body of evidence. The problem is that most of the research papers that have been published in regards to ivermectin had small sample sizes and were not and had a lot of risk for bias. So there are several studies, big randomized control studies that are in the works, but it's something that is being used especially in middle and lower income countries. What we use here for some patients who meet criteria early on in the disease are monoclonal antibodies. There are randomized controls. There is this randomized control trial that does show some benefit, but it's still not enough evidence to recommend it as a standardized treatment for everyone. There are new agents that are being discovered daily. This one in particular does seem to have a good effect in vitro. We are trying to repurpose some other drugs. Favipiravir is being used in Russia, but not really in other countries. Now we do have vaccines, as you might have heard, varying efficacies in different vaccines. But the one thing you need to remember about vaccines is that all of them are close to 100%, if not 100%, preventing death of the person who got vaccinated after the second dose and after the full immunity has developed. Now, the new variants are concerning, but so far to this date, there have not been reports of people who were fully vaccinated, who had full immunity, who had severe infection and died from COVID. Now, at this point, all the literature, the international literature on COVID is free of charge. Normally, you have to pay for some of the articles, but at this point, everything related to COVID is free. So whenever I go to a talk or give a talk in South America, the first thing you hear is there's so much literature, it's impossible to keep up. It is possible to keep up. You just need to ask the pertinent questions and put them in your searcher and get the answer to the question and see what is the relevant evidence available to answer your question. Now, not all papers were created equal, and we need to be able to assess the quality of the evidence that we are looking at before we use it to make a medical decision. So critical appraisal of the papers that you're using to make your decisions is important. If we're able to use a stepwise approach to guide our decisions, we do improve outcomes. And we are able to not get caught in scams, if you will. This particular one was one that is very widely accepted, surprisingly, in South America. Chlorine dioxide, bleach, pretty much. And there were actual physicians who were prescribing it and who thought it was a good idea. So if you know how to ask some basic questions and you know how to assess the evidence of the literature, you are very well equipped to say, no, this is not appropriate. So we still have a lot to learn. There will be more pandemics, but we need to learn from our previous experiences. We're making our way one research paper at a time. So thank you all for your contribution. Thanks.
Thank you so much, Dr. Waira, for your very insightful presentation. Next, we will be joined by Dr. Rida Al-Lawati, who is an OMSP graduate, specialized in internal medicine and working in Royal Hospital in the COVID-19 field. His topic is COVID-19 and pulmonary mycobacterium tuberculosis co-infection. Welcome, Dr. Rida.
Thank you for your kind welcome, and thank you for the invitation. So I will be talking about this case report, which is about COVID-19 and pulmonary mycobacterium tuberculosis co-infection. So this is the outline. I will start with the introduction, then I'll present case 1 and case 2, and then we'll discuss some of these related issues, and then we will conclude. And just keep in mind that this was written and before and there are many updates that happened during the last few months regarding the management of COVID-19. So coronavirus disease, COVID-19, is caused by a novel coronavirus called severe acute respiratory syndrome coronavirus 2, which targets mainly the respiratory system. And it started in China in December 2019, and it was declared as pandemic by WHO on March 11, 2020. And we know that the incubation period of COVID coronavirus is 5 to 6 days, and the main symptoms are fever, cough, shortness of breath, and loss of smell sensation. And there are other symptoms that the patient might present with. So the main reported risk factors include age above 65 years and also the comorbid conditions such as diabetes, ischemic heart disease, hypertension, chronic lung disease, and immunosuppression. Now, on the other hand, pulmonary TB is one of the oldest diseases that affected human being long time ago. And we know that Mycobacterium tuberculosis is the most common cause of TB worldwide. And TB is a contagious disease. And a lot of patients that develop TB, they have latent TB as well. So the risk factors are similar: diabetes, immunosuppression, underlying chronic lung disease, and HIV. So during this pandemic, there are several of respiratory pathogens that had co-infected with COVID-19, and some reported bacterial, some reported fungal, and also 50% of the patients who died from COVID-19 had respiratory, secondary respiratory infections. So a multi-nation study found that 49 patients in China had TB and COVID-19 co-infection. 85% of the patient had active TB, while 18% of the cohort had diagnosis of TB and COVID in the same period. Another report from Italy found that there are 20 cases of TB and COVID-19 co-infection. 90% had active pulmonary TB, and one of them had disseminated TB. There was a report from Qatar as well. They reported 6 cases with co-infection of TB and Mycobacterium tuberculosis, and all the cases were middle-aged men. They had known history of direct exposure to TB, and they were from South Asian descents where TB is endemic. And all of them had pulmonary TB, and one of them had both pulmonary and pleural TB. So there is only one published case report in Middle East and North Africa regarding this co-infection, and here we present the first 2 cases of this co-infection in Oman. And actually, after we have written this case report, we had a few other cases as well. So the first case, he is a 56-year-old Omani gentleman who is active smoker, known to have hypertension and diabetes on treatment. He had 3 months history of productive cough and whitish sputum, but the patient did not seek any medical attention. Then later on, he developed very high-grade fever associated with sore throat, flu-like symptoms, headache, and he was admitted to our hospital. He had no hemoptysis, no shortness of breath, no chest discomfort, no weight loss or night sweats. He did not travel, and he did not have any sick contact. So he was febrile with a temperature of 39.2. He was tachypnic with a respiratory rate of 26 breaths per minute. His heart rate was 80 to 90, and his blood pressure was normal. He did not have any palpable lymphadenopathy, and chest examination showed bilateral equal air entry. However, there were bronchial breathing in the right upper lung. So the chest X-ray, which was done, suggested that there is thick wall cavitary lesion associated with innumerable nodular opacities, and there was right lower zone ill-defined airspace opacities with a subtle nodularity. So his WBCs, white blood cells, were 7.2 with neutrophil counts of 4.3, and lymphocyte count was 1.8. His CRP was high and ESR was very high. His LDH was normal and ferritin was normal as well, and D-dimer was normal. So this is the chest X-ray. We can see the right upper lung zone, a thick wall lesion, and it is also there are some innumerable nodules as well. So the patient was empirically treated as per the national guidelines for COVID-19 at that time with ceftriaxone, clarithromycin, oseltamivir, and he had also nasopharyngeal SARS-CoV-2 PCR and sputum for Mycobacterium tuberculosis, which came positive. So he was started at that time with hydroxychloroquine, lopinavir, and ritonavir, and also anti-TB treatment. Then the patient improved and he was discharged home to continue his anti-TB medications. So, and the second case, he's a 42 years old, non-smoker expatriate man. He does not have any medical condition. He presented with cough, shortness of breath, chest pain for 3 months, and he had weight loss as well. However, he did not seek any medical attention. The patient, prior to admission, he had very high grade fever of 39. However, he did not have any sick contact and no recent travel outside the country. On presentation, he was desaturating in room air to less than 90, and while giving him 2 liters of oxygen, it improved to 95%. He was hypotensive with blood pressure of 85/50, and he was dehydrated, having dry mucous membranes, and his capillary refill was more than 3 seconds. His chest examination revealed bilateral coarse crackles, and it was more in the right side. Actually, this patient had a negative SARS-CoV-2 PCR test done in local center. So the patient was started on ceftriaxone, clarithromycin, and oseltamivir, and he had also had high suspicious of COVID-19 infection. So his chest X-ray showed that there is diffuse nodular pattern with airspace opacities in the right lung zone, and in the left upper lung zone he had also airspace opacities with some nodularities as well, which are suggestive of pulmonary TB. His WBC were 8, neutrophil count 6.5. He had lymphopenia of 0.5. His CRP was very high, 194, and his ESR was 85. He had a repeated SARS-CoV-2 PCR test, and also sputum cultured for Mycobacterium tuberculosis, and both came as positive this time. His ferritin was very high of 1,170. His lactate dehydrogenase was high as well, and his D-dimer was very high as well of 11.44. The patient was started on hydroxychloroquine and anti-TB medications. So, and then the patient improved and he was discharged home to continue his anti-TB medications. And this is his chest X-ray involving the whole right lung and also upper zone of the left lung. So in discussion, now we know that COVID-19 is caused by a novel coronavirus that belongs to genus beta coronavirus called SARS-CoV-2, and it transmits through human-to-human contact. And in human, coronavirus can cause a variety of respiratory illnesses, which are ranging from sometimes asymptomatic, common cold, to severe pneumonia, such as SARS-CoV and MERS-CoV as well. And there are few case reports of co-infection between SARS-CoV and MERS-CoV infections. And regarding COVID-19, also there was a report in Islamic Republic of Iran of influenza A virus co-infection. So here we reported 2 cases of COVID-19 pulmonary TB and pulmonary TB co-infection. And to our knowledge, there are few cases reported. And the first reported case were from China. 2 of their patients were treated for active TB years before having COVID-19. And now they presented with reactivation of TB plus COVID-19. And another one was not treated for TB for more than 50 years. In Philippines, 1% of the patients who were infected with COVID-19 had co-infection with TB. And it was found that the patients with TB had 2.17 times higher risk of death when compared to those without TB. Additionally, those with TB and COVID-19 co-infection had 25% less risk of recovery than patients without TB. In South Africa, around more than 2,000 patients had TB and COVID-19 co-infection out of the 22,000 patients studied, and they found that having TB have worse outcome compared to non-TB patients. Now, in this case report, the first patient is a chronic smoker. He is hypertensive, diabetes, and all of these are risk factor of TB and also risk factor of COVID-19. And since his symptoms started in the period where COVID-19 infection started in Oman, his findings are more likely to be a co-infection rather coincidence. The other patient, despite being free of medical background, he is from an area that has high TB burden, so it is more likely that he had reactivation and co-infection. Now, in 2018, the annual incident rate of TB in Oman was less than 5.9 cases per 100,000 population, and 60% of the annual cases were from non-national citizens. It was noted that from previous MERS-CoV and SARS-CoV that TB and those infections may augment and cause immunosuppression, which might be similar to what happened now in SARS-CoV-2. There are few case reports indicates that patients with pulmonary TB are more susceptible to develop SARS-CoV-2 infection, as both could impair the immune system. And this synergism may cause very severe clinical picture. Those researchers claim that pulmonary TB is a major risk factor for COVID-19 infection. One of the proposed pathophysiological mechanism for COVID-19 co-infection for COVID-19 infection is cytokine storm, and these cytokines play an important role in TB host resistance. Now, another pathophysiological mechanism that the lung damage caused by TB increases the body's susceptibility to get other airborne infection such as COVID-19. Now, we need more studies that aim at looking on the impact of TB and COVID-19 co-infection in terms of morbidity and mortality. And studies are needed to develop strategies and plans on how to contain the co-infection and prevent further spread of both diseases. So in conclusion, COVID-19 is an emergent infection that can coexist with other pulmonary infections. Mycobacterium TB is a pathogen that can coexist with COVID-19 infection and require high clinical suspicion when the chest radiograph is very suggestive of pulmonary TB. Early recognition of TB would result in initiating of appropriate infection control measures and anti-TB therapy. And we need to screen all patients admitted with SARS-CoV-2 infection for TB, because this is might have important in defining the role of COVID-19 in reactivation of TB. Finally, clearly documented diagnostic and management algorithm should be implemented in order to improve the outcome from this co-infection. Thank you, and if you have any question, I'm more than happy to answer.
Thank you, Dr. Reza, for your very interesting presentation. Now I welcome Dr. Omar Chouhan. He's an associate professor and a vascular interventional radiologist, associate program director, radiology residency at University of Buffalo, New York. He's also involved with Great Lakes Medical Imaging and Gates Vascular Institute. Dr. Omar, the floor is yours.
Hi, Aisha. Thank you for introducing me. It was very nice of you. Good, I guess it's evening in Oman. It's still morning here in the US, so good evening to everybody. Thank you for having me on. I'm going to share my screen and we will start. Okay. So my talk is going to cover imaging findings related to COVID-19 and how it sort of manifests into the patient and what we do to help manage them and get them to a road to recovery. If you want to follow me on Twitter, you may, for anybody that's a Twitter fan. So we're going to review some common imaging findings with COVID, review some of the common clinical manifestations of COVID, and then obviously just we'll understand sort of the course of COVID-19 and the infection that it causes. So just to sort of briefly cover some of the pathophysiology of SARS-CoV-2, it may have been covered over the course of the talk, but just to sort of refresh everybody's memory, there's an S protein that sort of activates the immune system. Once the immune system is activated, it causes sort of a huge cascade here in the alveoli of the lung. So, you know, it's been mentioned the cytokine storm here is a huge player in sort of the disease process, but also to know that there's a capillary leak that happens over here. You get endothelial cells that kind of go out into the alveolus. It causes this pulmonary edema. You get interstitial edema along the vessel wall. And then another big player is you get embolism. So the blood tends to clot because of the inflammation. And really the two major players that we see in radiology that affects our patients is the pulmonary edema, interstitial edema, and then the blood clot formation. And for a lot of patients, this blood clot formation, this microthrombi that occurs in the vessels, plays a big role in terms of how we manage the oxygenation status for these patients and how it affects the rest of the vasculature throughout the body. So we'll kind of just briefly start out covering just the basic imaging features on a CT scan of a COVID infection. And I'll kind of briefly just go on a tangent and just talk about other radiology language that occurs when we're reading imaging. There's really two types of things that we can talk about. One is a consolidation, and another is ground glass opacity. The difference between the two is what you can see through the opacity. In a ground glass opacity, you can see the vessels as they course forward. So I'm hoping you can see my mouse, but the vessels are seen through the opacity here. So it's called ground glass. In a consolidation, it's more dense. You can't see structures inside the area of abnormality. And we also describe things as being peripheral. So peripheral meaning in the outside of the lungs over here versus central, which would be kind of near the trachea and the pulmonary vessels. And again, something more peripheral here. You can also have perihilar things, which are more, again, by the hilum. And then, I could go for hours talking about, the findings, but the major features of the COVID-19 infection is these peripheral opacities, which occur predominantly along the lung bases as well, and their ground glass appearance, meaning that they're, the infection is predominantly involving the alveoli and the interstitial tissues. There's other appearances too that you can have for the infection. This is a little more subtle. These are more ground glass opacities. You can see the vessel coursing through them. What you do notice is that instead of the last picture where this looked more just like a smudge, this picture has more of a net-like appearance. You can kind of see the interstitial, so the lung more prominent. Again, it has this more like lace-like, net-like kind of appearance. And again, there's a more subtle ground glass opacity here, the similar kind of picture. So those are two types you can see. And then the third type, it's just a similar thing. You have this peripheral opacities, the peripheral ground glass opacity. And here's more of a consolidation that I'm talking about. You don't see vessels that kind of go through it, but the periphery also has a ground glass appearance to it. So when we're talking and describing about COVID-19, this is sort of what we're talking about, these imaging features. As I go back, I don't have any chest x-rays to sort of, cross-reference, but anytime, at least when I'm reporting out chest x-rays or chest CTs, pulmonary interstitial edema, just plain fluid overload, can have a similar appearance. So I always give the clinicians a little bit of a way to exclude COVID-19 or think about other things that can have a similar appearance. So the disease progression, Some people, will go to recovery from this stage, but other people are going to slowly progress into more chronic stage. So the thing about COVID-19 that's really surprising about it is just how quickly it can cause scarring of the lung. And that has significant implications for the morbidity of the patient and how they're going to leave the hospital after they suffer from the infection. So, from the time of presentation, a patient can have these peripheral glass opacities with sort of more linear areas of consolidation, which is probably just more dense area of infection. As they progress, you get more fluid, you get more inflammatory cells in the area of disease, and it becomes less ground glass and more consolidative. At this point, patients' oxygenation may suffer, and they have more difficulty breathing. And so you're challenged with how do you get these patients either off a ventilator or how do you get them out the door. And as they get towards recovery, everything seems to improve. The ground glass opacities are getting less, but it starts to look more linear and well-formed. And as time goes on, all of a sudden the lungs sort of look very irregular. You get this linear scarring. You have these, they call these parenchymal bands. There is the areas of just architectural distortion. You kind of get the idea that the lung is just held up. See these areas that there's these tented areas, there's these peaks at the mediastinum. Over here, there's these peaks, there's another peak. So there's a lot of scar tissue, a lot of fibrous tissue here in the lungs, and that's gonna get the patient, yes, they're no longer infected, but they're gonna be chronically short of breath. They may not have their exercise capacity at the same level. And these are the patients that we need to be concerned about because it's gonna significantly affect their quality of life. Now, another way that the COVID-19 infection can progress is instead of lung fibrosis, you can start getting cavitary lesions. And I think the talk that we had before about co-infection with TB is incredibly important because you can get co-infections with other diseases too. So in this patient that had, again, peripheral ground glass opacities here, one's kind of going towards the center, but it's progressively getting more consolidated as, again, the infection continues on. You're getting some areas of sort of this linear banding, this scarring tissue. We continue to progress. Things seem to be improving. They're consolidating. They're getting more scarring. You can see these linear areas here. There's more scar tissue. But this area in particular is an area of focus. And as we progress down over here with this red arrow, you see a cavity forming. Now, you can have, like something like Staph aureus or strep pneumonia coming in here and making a cavity, or this could just be a post-infectious cavity from COVID-19. But I think it's important to recognize the different types of pathways that COVID-19 can have, because again, it's going to have clinical implications. This cavity down the road may just heal on its own, but it could become super infected with a fungus of some sort. So these patients are important to follow up. Then the other way this can go is to a path where where patients don't do so well over time, and that's when they get the acute respiratory distress syndrome, or ARDS. So again, you have these peripheral ground glass opacities in the early stage. The consolidation kind of continues on. The infection worsens. And then as time goes on and our medical management is no longer working, you're seeing really more diffuse areas of consolidation. You still have these ground glass opacities, but this is the stage where the lungs get more wet, when the pulmonary edema really takes over. The alveoli are filling, their oxygen saturations are no longer meeting their requirements for the heart. They get into degrees of cardiac compromise. So this is when patients are intubated, or probably on pressors, and they're trying to figure out the best ways to really manage this stage. At this stage, patients are usually in the hospital a lot longer, 2, 3 weeks, 4 weeks, sometimes longer. And they may heal this completely, or they might get that scarring. Now, we talked about briefly in this slide with the pathophysiology about the microemboli that can occur. The COVID infection is thought to be also thrombogenic, like many other infections, except there's been a higher incidence of things like stroke, pulmonary embolus with patients that have COVID-19, and that puts a pretty big challenge on these patients because they're already having some respiratory compromise, and now all of a sudden you're really challenging their lungs to become perfused. So here's a contrast enhanced image. This is an axial image of the pulmonary artery. So here's the main pulmonary artery. Here's the left pulmonary artery, and the right's coming over here. So you can see there's a filling defect here. This is a blood clot that came from the leg. Here's another blood clot over here. This is a reformatted image that's taken in a coronal plane, and you can see there's a blood clot going up here this way, and from the right pulmonary artery up to the superior pulmonary artery. And then this is a blood clot here in the left. The bottom pictures, this is showing you a pulmonary infarct. And then here you're seeing on the bottom right-hand image, this is more of a COVID-19 infection. And now you're getting more of a wet lung here with a little bit of atelectasis and effusion. So this patient, although the lungs don't look that bad, they're showing signs of progression with atelectasis, with some effusion, and the pulmonary embolism. And this we'll talk about in a minute on ways we can manage that. So again, things that can happen, we kind of went over like a superimposed pneumonia. Again, we talked about earlier in earlier lectures of TB, but you can definitely get bacterial pneumonias that can be super infected, and that just make things worse. So to manage that, antibiotics. ARDS and pleural effusions aren't uncommon, but they do make the picture a little bit more complicated, because all of a sudden now you don't know, is the patient fluid overloaded or is it really just progression of the infection? And that has, there's different ways that the ICU physicians and clinicians in the hospitals are managing that. Pulmonary embolism, we looked at that picture real quick. Stroke, this is very common now to see patients suffering from strokes with COVID. There's a couple case reports that have been written up on that. I won't delve into that too much, it's out of my realm. And then DVTs, obviously being the source of the PE, but DVTs can occur in most of these patients. But again, they usually progress to the pulmonary embolism. So what do we do in terms of how the disease progresses? If you're just coming into the hospital with mild disease, you have a little bit of ground glass opacities, it's just simple oxygenation. We're not intubating yet, we're just monitoring you, you're getting oxygen, you'll be admitted, and then you'll be given a variety of medications to sort of help you recover. If you progress into hypoxic respiratory failure, they recommend using nasal cannula. So at this point, from an imaging perspective, it's going to look more like the ARDS picture, or it's going to look more consolidative. The disease is progressing. Once the imaging findings demonstrate more ARDS, then it's the time to intubate. So what I find interesting about the management of COVID is they're no longer really intubating in this early phase, because again, the thought process is not so much an issue of aeration, meaning it's not that the airways are getting obstructed, it's more that the vessels, the distal capillaries are getting obstructed. That's been a problem. So you need to be able to deliver more oxygen. You don't need to help them breathe. You just need to help them deliver the oxygen through the blood vessels. But once they get to ARDS, all of a sudden now the need to actually breathe through the lungs becomes more demanding, so they have to start to intubate. And then once you get to this moderate to severe ARDS, things are progressing, then you're kind of going, you need to do prone, this is prone, not prove, prone intubation. You put them on the belly, and it helps, gravity will help compress the lungs and allow for better aeration. And then you can give them meds to do some pulmonary vasodilation again to improve the blood flow. And obviously, if you're in shock, you're going to get vasopressors. And for shock, I really can't tell much on imaging, but that's sort of like where COVID can go. If you have pulmonary, if you have a PE on COVID, you can anticoagulate, you see how they do. Or you can do catheter-directed thrombolysis, which as an interventional radiologist, this is where we go into the femoral vein or the internal jugular vein, and we administer TPA into the pulmonary arteries and try to break down the clot. Or you can go and take these bigger devices and just completely remove the thrombus and help them recover and relieve the pressure from the pulmonary arteries. If you have a stroke, you can anticoagulate, or you can do a thrombectomy as well. That's all I have. Are there any questions?
Thank you, Dr. Omar, for your very exquisite presentation.
Thanks.
We'll continue with our last presentation now. So for our last presentation for today, it's Ms. Fatima Al-Busaidi. She's an MD4 student here at National University. Her topic is COVID-19 and final year medical students learning courses in Oman, exploring knowledge, consequences, and preparedness for internship. Welcome, Fatima.
Yes, hello everybody. It's an honor and a glad to be one of the speakers here among these incredible sectors, international and national speakers. Thank you, Dr. Muhammad Al-Shafi, and thank you, Scori family, for this acceptance. Now, humbly, I will introduce my article, which has come under the title of COVID-19 and Final Year Medical Student Learning Processes in Oman, Exploring Knowledge, Consequence, and Preparedness for Internship. This research done by like 8 co-authors. The corresponding one was Dr. Hatem Sadi. He is a consultant in upper GI surgery. Now I will go to the introductions. As introductions, everybody knows that coronavirus or COVID-19 is a cluster of acute respiratory illness known as a SARS coronavirus 2. And this is pandemics that affect all aspects of life. And here's, I'm focused more on implications part. This is because the pandemics, the COVID-19's pandemics is putting an enormous stress on a healthcare system. This is due to part of a rapid increase in number of the patients, number of the cases, and some cases that the healthcare itself, they get sick or they are in a high risk. So to talk more about the final year medical student here in Oman, we have 2 colleges, 2 medical school, which is the SQU and the National University. The numbers of final year medical students for the previous was 227, and this is article actually done at April. And the numbers now go to the aim, and the aim of this article. The aim of this cross-sectional study to evaluate the final year medical student to prepare perceptions and preparedness of internship and assess their knowledge in COVID-19, the patient management, and illustrate COVID-19 specific training and explore the pandemic's consequence on medical education in Sultanate of Oman. So now we'll talk the method that we follow in this research. As it the show here, we go in 3 steps. The first one was participate and sitting. As I just mentioned before, in Oman we have 2 medical schools, the National University and SQU. We did a survey, which is an online survey, and we distributed among these 227 students. Then the number that we get is 1 and 6, 1 and 6 response, total response, 106. But we exclude 7 of them because not all of them, they are at final year medical students, and also not all of them, they are studying here, some of them, they are studying abroad. So the total number that analysis was 99. Then we go to the questionnaires design. In the questionnaire design, we did 5 sections questions. And this is 5. The first one was social demographic. Second was perceptions and preparedness of internship. And third, awareness and knowledge on COVID-19. fourth was COVID-19 training, and the last was COVID-19 consequence. Now to talk about the statistical analysis. Here we collect the data and then put it in Excel, and we use SPSS for analysis. Then we use two tests, special expert test and chi-square test. The p-value was less than 0.05, which means they are statistically significant. Then we talk about the results that we had. The result is shown here. The majority of age of the participants were between 24 and 26, which is equal to 82%. Then the majority of the gender were female, which is 84.8. The nationality, the majority were Omani, and the university, the more participant from national university, which is equal to 56.6%. 4 of the participants are intending to do their internship program abroad. Now we'll go to the second point of the result, which is perceptions and preparedness for internship. We did ask 80 questions. If we see here like question B1, B3, B5, and B8, like more than 90 participants, they are answered correct. But if we see the questions number B6, which is asking about the emergency management, it was the least. It was 49. And then the other one, which is confidence in carrying word procedures, was also less, which is 57 correct answer. In SQU, the study found that 81.4 participants were able to carry basic word procedures, for example, cannulations and NG tubes, while only 39.3 of national university students answered they were competent with the procedures. The difference in competency in carrying basic word procedures between the two medical schools was statistically significant. Then I will talk about the third point of the result, which is the COVID awareness. As it's obvious here, we categorize 5 themes, which is pathogenesis, WHO rules, health measures, medical management, and infections control. If we see the chart, the lead in infection control, like low in questions related to the infection control, followed by health measures theme. Despite the overall satisfactory level of awareness was more than 50% correct answer. And now if you see, like, this is correct answer, both awareness was more in national university. Now I will talk about the COVID-19 training, and then I will end with the COVID-19 consequences. The COVID-19 training, the majority of participants had training in hand hygienes in last 12 months, which is 86.9. However, only 18 participants had formal specific training about COVID-19, preparedness and management. About 12.1% of participants participate in online courses or forms of teaching about COVID-19. There were higher level of awareness in current Ministry of Health policies on management of a patient with a COVID-19 among national university participants than SKU. And the training and preparedness for COVID-19 were more in female or higher in female than the male. Now I will talk about COVID-19 consequences. About 1/4 of the participants had volunteered to help the healthcare professionals during the pandemic. This was significant for a different age group. The measures and preparedness in taking the pandemic have illustrated the rules of infections control and public health and increased participant knowledge on their specialties. Therefore, 47 participants have expressed their interest in pursuing public health and infection control as a career. Now I will go with the conclusions. Guaranteeing medical students join the medical task force with the knowledge and experience came throughout the undergraduate years. The ongoing year raises in a confirmed cases every day. Duration suspicions of the on-campus teachings in a higher education institution in Oman is still ongoing. The COVID-19 pandemic has affected the teaching process and limited student-patient interactions. The overall perceptions and preparedness for internship among medical students in Oman is good. However, further education in emergency management and practicals ward procedures are still required. This study highlighted the good effort in delivering the specific knowledge and the practice in COVID-19 and patient management is recommended. Overall, there is satisfactory level knowledge in COVID-19 between participants. However, gaps in knowledge related to hand hygiene and measure of infections control has been identified. The global response to COVID-19 pandemic has increased participant interest in public health and infections control activities. I end up my article presentations. Hopefully it was knowledgeable. If you have any questions, please don't hesitate to ask. Thank you.
Okay, thank you very much, Fatima. And now I open the forum for the question answer session. You have 4 speakers in this. Dr. Vera has left because she has something to do there, and she has given her email. If you have any question, you can email her. You have Dr. Rida, Dr. Umar Chauhan, and Ms. Fatima. So kindly write the questions in the chat box.
There is a first question for Dr. Waira. Is it true to assume that some deaths of COVID-19 happen due to the hospitalization conditions rather than as a complication of the infection?
Aisha, Dr. Vara has left because she was busy. So you can ask the next question. Okay, Dr. Umar, I have one short and brief question for you. In South Africa, some doctors, they have done bronchoscopy in the coronavirus patients, and they have found a lot of mucus plugs obstructing the airways. So what do you think in the patient, if this could be a way to treat the patients when they are in the ICU? Hello, Dr. Umar Chauhan, are you here? Dr. Chauhan, can you unmute yourself? I think he is not able to answer the question. Yes, Aisha, you have any question?
There are no other questions from the chat box.
Okay, no other questions from the...
There is from Dr. Nasser. Dr. Rida, did you... Dr. Nasser is asking Dr. Rida.
Yes, so the question is...
Are there any specific clinical signs that are specific to Omani COVID-19 patients?
No, actually, we did not have any clinical or specific clinical signs and symptoms for Omani COVID-19 patient. They come with variety of symptoms. Most of them are coming with the respiratory symptoms, shortness of breath, cough, high-grade fever. But some are coming with the GI symptoms, dehydration, and diarrhea with some vomiting as well. And we noticed that we had very few patients who came with picture of meningitis as well.
There is another question on the tuberculosis that Recharge, isn't it true that damaged lungs because of TB should be less susceptible to COVID-19, at least less severe?
No, actually, the damaged lung because of TB make the COVID-19 more susceptible there and also more severe presentation. It is not less. When there is a TB co-infection, the COVID-19 picture usually is more severe. And regarding the local or international guideline, we are following local guidelines that are updated regularly by MOH.
There is a question for Dr. Rasai. Is Dr. Khalid Al-Rasai still around? Yes, he is still around. So the question is it feasible to conclude that the story ends with the recovery of patient from COVID-19? I mean, should we further investigate the residual long-term effects of the infection on the physiological and molecular basis? This question is for Dr. Khalid Al-Rasai. I think is not there to answer the question. So is there any other question for Dr. Rida? I don't think there is any question coming in the chat box. Aisha, can you see any other question in the chat box?
There is a question that was for Dr. Waira, but if someone can answer from any of the presenters, it would also be good. The question is, how do you decide the most ideal regimen to a COVID-19 patient with unremarkable medical history?
Yeah. Anyway, Dr. Rida, I have another question for you. Dr. Rida, did you any specific clinical signs that are specific to Omani COVID-19 patients?
Actually, there are no specific signs for Omani COVID patient. We have noticed that they present like any other COVID patient around the world, mostly with respiratory symptoms, some of them with GI symptoms of dehydration because of diarrhea and vomiting with some abdominal pain. And also we noticed few patients, very few patients presented with picture of meningitis. However, there is no specific clinical signs for Omani COVID patients.
There is another question saying, are you following local or international guidelines in these cases?
We are following local guidelines, which are updated regularly by MOH in a regular basis.
This question again for you is it feasible to conclude that the story ends with the recovery of patient from COVID-19? I mean, should we further investigate the residual long-term effects of the infection on a physiological and molecular basis?
I think this question is to Dr. Khalid Al-Rassadi.
No, it's actually for you. Ah, okay, yes. It is for Dr.
Khalid. And he's back. I think
He's
Dr.
back?
Khalid can answer.
Okay.
Yeah, sorry. Sorry, I missed the questions. What is the question again?
Yeah, is it feasible to conclude that the story ends with the recovery of patient from COVID-19? I mean, should we further investigate the residual long-term effects of the infection on a physiological and molecular basis?
This is very good question. Actually, I'm not an expert in infectious disease, so I don't think I would be able to tell you the truth. I mean, we know that it's very important, you know, to keep this biobanking for genetic for future studies, but whether that will really help in recovering from this, I'm not an expert in that.
If I may answer this question, actually, now we are seeing the complications of COVID-19. A lot of patients, after we discharge them from the hospitals, they come back with complications, and mainly the complications are lung fibrosis. So in terms of molecular basis, I'm not sure about that, but the residual effect of lung fibrosis is there. And this is one. The second thing, we noticed that a lot of patients who come or present with COVID-19, they have diabetic ketoacidosis. So as a long term, there will be diabetics on insulin. So those are few of the impacts of COVID-19. So after recovery, a lot of patients come back with complications.
Thank you, Dr. Rida. There's another question for Dr. Khalid. The question is, have there been any moves in the Middle East region to bring about collaboration amongst nations in controlling the current pandemic in the region? Repeat the question. Have there been any moves in the Middle East region to bring about collaboration amongst nations in controlling the current pandemic in the region?
To my knowledge, I am not aware, but I know on the level of World Health Organization, there was definitely a lot of cross-global studies like the solidarity trials. And Alhamdulillah, Oman was also part of that. Many, I know the countries from the Middle East, they were also involved. But per se, from the Middle East region, I don't think so. And again, this is what we were talking about in the presentation. This is what we need. I mean, for future, we need to look at our database, either nationally, regionally, or internationally, and see how we can benefit from this database again in terms of better management in the future for these pandemic diseases. So definitely this is what we need to look at.
Thank you, Dr. Khalid. There's another question for you. Research methodology, validation, and combating plagiarism might prove to be difficult. What is the best approach to do this in the midst of surging COVID-19 research?
Yeah, this is an excellent question, and this is why I refer to the good thing about using these technologies, especially the artificial intelligence or the machine learning. We can utilize, I mean, this technology really to scan huge databases, again, to look for plagiarism and also to look for nobelities, again, in terms of new molecules that will be good, you know, for future either vaccine or therapeutic drug development. And this is not only for pandemic diseases, but I say also this is for a good thing for even non-communicable diseases. We have, you know, huge prevalence of cardiovascular diseases, cancer diseases, diabetes, obesity. So this is where also we should put our, you know, investment and research innovation into.
Okay, very good. Very good. Thank you so much, Dr. Rida. And this is the last question for this session. It says, regarding the lung fibrosis complication, is it affecting a specific age group?
Actually, this is a very good question in terms of research, as now we are seeing a lot of patients coming post-COVID. However, from our observations, we have noticed that it comes through all age groups. However, the more severe the disease is, the more lung fibrosis will happen. But it is a very good idea to start studying this issue in post-COVID patients.
Okay, thank you very much. With this, we come to the end of the session today. I am really thankful to all the speakers, especially I'm thankful to my international speakers from New York. They spared their precious time and they give us excellent talks. Now, I would like to remind you that the next day will be tomorrow. We will meet again at 6:30 p.m. on the same forum, WebEx platform. So until then, I say goodbye to you and see you tomorrow at 6:30 p.m. Goodbye and take care.
Thank you very much.